Part of the occupational English test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a healthcare professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physician talking to a new patient called Mrs. Delilah. For questions 1 to 12, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Hello, doctor. Good morning.
Good morning. Tell me, what seems to be the problem?
Doctor, I am a patient of I-131-induced hypothyroidism for the past 6 years and have gained weight and edema over the last 3 weeks.
Your age?
57 years. I also have other complications like fibromyalgia, Crohn's disease, inflammatory bowel disease, COPD, and disc disease, as well as the thyroid disorder. Also, my abdominal girth is increasing. Plus, I have increased edema in my legs, doctor.
Oh, I see. What medications were you taking?
I was on Norvasc and lisinopril for years for hypertension. I also take Synthroid and thyroid hormone.
Do you smoke or drink?
No, doctor. I had a hysterectomy and a cholecystectomy surgery 2 years back, doctor.
It seems you're allergic to IV dye, sulfa, NSAIDs, compazine, and Demerol.
Yes, doctor.
Do any of your close family members have thyroid disease?
Yeah, my sister has Hashimoto thyroiditis and Graves' disease.
It seems you've gained 20 pounds of weight during the past few weeks.
Yes, I experience frequent sweats and fatigue as well.
Do you feel any chest pain?
No, doctor.
What about your bowel movements?
It is loosened, doctor.
Do you have abdominal pain?
No, doctor.
Your blood pressure shows 140/70, and your heart rate is 84 and a febrile. You are clinically and biochemically euthyroid. Your TSH is mildly suppressed, but your free T4 is normal, and with your weight gain, I am not going to decrease the dose of levothyroxine. I will continue you on 300 micrograms of Synthroid daily. If you want to lose your weight, then repeat the thyroid function test in 6 weeks' time to ensure that you are hyperthyroid.
Okay, doctor.
I need to explain to you a few things about edema. For the optimal functioning of our body, the water content should be about 70%. This takes care of regulating our water balance. Our kidneys regulate the water level of our body with the help of the antidiuretic hormone called vasopressin. The pituitary gland secretes the vasopressin to prevent excessive water loss from our kidneys, to hold on the water level to ensure optimal functioning of our body and prevent dehydration. More or less, edema is a symptom of a malfunctioning of water regulation process of our body. Once our body has an adequate water level, and when our kidney excretes water, vasopressin should turn off. However, in the case of edema, vasopressin mechanism malfunctions and our body continues to retain excess water.
Other than medications, what can I do to control edema, doctor?
There are certain simple dietary and lifestyle choices I would suggest for you which can promote healthy elimination of excess water. One of the most prominent things you can do is to maximize your water intake through drink and food. Excessive intake of water promotes regular production and expulsion of urine called diuresis.
What are all the foods I should eat, doctor?
Foods such as celery, grapes, melons, spinach, carrots, and other green leafy vegetables. Similarly, try to reduce the sodium intake in your diet. High sodium always leads to excess retention of water. Beware of canned and processed foods, which are often high in sodium. Foods such as white bread, refined foods, refined sugars, pasta, and even alcohol can result in water retention. Exercise of any kind that increases heart rate is very helpful in promoting the fluid movement from the extremities to the heart, therefore reducing edema in the extremities.
Thank you very much, doctor. Extract 2. Questions 13 to 24. You hear a physician talking to a patient called Mr. Chatuluka. For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes. Colon cancer screening.
Good morning, doctor.
Good morning, Mr. Chatuluka. Please, tell me about your problem.
Actually, I was referred for evaluation of colon cancer screening, doctor.
Right. What's your age?
53 years.
Do you have any complaints such as diabetes, hypertension, or any other issues?
No, doctor.
How is your bowel movement?
I get some loosened stools and occasional constipation.
Are you under any medication at present?
No, doctor.
Have you previously had any surgery?
Yeah, I had a deviated nasal septum done in 2003, doctor.
Are you allergic to any medicines?
Not at all.
Do you smoke or drink?
Yeah, I used to, but for the past 4 years I have dropped those habits.
Do any of your family members have a history of colon cancer?
No, doctor.
Any difficulty in swallowing, nausea, or vomiting?
No, doctor. I get heartburn occasionally.
Okay, that's fine. Here, Your diagnosis report shows your blood pressure as 111/70, weight 215 pounds. Your pulse rate is 69 and respiratory rate is 18. Neck, supple, no thyroid megaly. Cardiovascular. Both heart sounds are heard and rhythm is normal. Lungs are clear to percussion and auscultation. The abdomen is soft and non-tender. So, I would suggest you go for a virtual colonoscopy. You might have heard how great colonoscopies are in preventing colon cancer. We normally recommend a colonoscopy after the age of 50. Virtual colonoscopy is an X-ray equipment which is used to diagnose large intestine for any cancer and polyp growths. You should take only clear fluids a day before the diagnosis, and I will give you instructions on how to clear your bowels. You shouldn't eat or drink anything for a few hours before the diagnosis. If you have an allergy to contrast material, I will prescribe medications to reduce the risk of an allergic reaction, which you must take 12 hours prior to the diagnosis. A very small tube will be inserted 2 inches into your rectum to pump air gently into the colon using a handheld squeeze bulb. This would inflate the colon to eliminate any wrinkles or folds that might hide polyps from the view. Thereafter, the table will move through the scanner, and you will be asked to hold your breath for about 15 seconds before changing your positions, a second pass that is made through the scanner. A tube will be removed once the scan is done. The entire diagnosis will usually be completed within 20 minutes. The minimal risks involved in this diagnosis process is that the inflating of the colon with air could injure or perforate the bowel. However, this happens in fewer than 1 in 10,000 patients. There's a mild chance of cancer formation from excessive exposure to radiation.
Okay, doctor. I think I will go for a colonoscopy.
Fine. I have explained the complete process of the colonoscopy with risks involved in the process, especially the risk of hemorrhage, perforation, and infection.
Thank you, doctor.